In Goa, cities like Panjim, Margao, Vasco, Ponda, Mapsa have CHCs, private hospitals and specialist doctors. Qualified doctors and quality medicines are available for people 24 hours in urban areas. But in rural parts of Goa, people are far away from basic healthcare facilities. The things are different from urban areas. The villages don't have sufficient primary healthcare facilities. Most suffering areas are villages at foothills of Western Ghats and in talukas Darbandoda, Satari, Sangam, Kepe, Kankot. Most of the villages do not have access to critical care medicines facility. Villages are so far placed in some areas that the villagers have to travel approx 30 kilometers to reach the basic healthcare center. Will there be any remedy to such situations that are faced by the villagers quite often? In June 2016, to tackle the basic healthcare issues and to reach out the needy community, Colorcon Asia Private Limited, in association with Voluntary Health Association of Goa (NGO), came up with the answer of community questions about basic health.
Voluntary Health Association of Goa is a no-profit NGO working in the field of health and related social aspects for the last 20 years. The need has always been there in many of the settings of interior rural Goa to get accessible health care. A much needed opportunity to serve these rural pockets came our way through the Arodhya Express mobile healthcare vans. We would wholeheartedly like to thank Dr. Rajesh Parab, the Managing Director of Colorcon Asia Private Limited, and the entire Colorcon CSR team for understanding the need and taking up the issue and providing the funding and overall support in providing the Arodhya Express mobile health van.
There are two areas, healthcare and education. In the healthcare, we look at prevention rather than a treatment type of courses. So we work with our partners who get into the remote places where the people have no access to government facilities. So we do a health checkup, like a dental checkup, health checkup. We start from the young children in the schools, so ensuring that they have a good dental hygienes. And that is where, if you don't have a good dental status of your health, then that has got an impact on your overall general health. You don't eat properly, you have malnutrition, you don't digest properly. And we educate the people about communicable diseases and non-communicable diseases, how to take care. We provide them some support. We refer them to big hospitals, and we talk to the big hospital about taking these people on priority.
Connexus has been associated with Colorcon since inception of the CSR program. We are working with them in developing the strategy and rolling out the strategy and monitoring the programs, identification of partners, doing the audit process on the program, and continuously improving the program.
The program includes the equipped specially built vans. Diagnostics include the pressure machine, sugar testing, ECG, hemoglobinometer, diagnostic tests, nebulizer, etc. Medicines includes antibiotics, painkillers, skin disease medicines, antihypertensives and antidiabetics. The working team includes MBBS doctors, coordinators, nurses, drivers, data staff.
My name is Trupti Gaonkar. I'm a project executive for Arodhya Express, Sangam office. I feel really proud that we are addressing different issues of people in the villages, rural villages, which is possible only because of Colorcon Asia Private Limited. The main aim of Arodhya Express vans is to provide a basic health services for people and to improve their health standards. The areas which we have scrutinized in the state of Goa are located in a very interior places who doesn't have a private hospitals, neither the PHC. The timing of the camp is from 9 to 4:30 till 5 o'clock.
Tracking is done by GPS that gives control over speeds, monitoring the vans at location each day, and GPS report at the end of the month.
Let me brief about the staff structure. Staff structure consists of coordinator, medical consultant, nurse and assistant. Coordinator, who is a very important person in the van because he is the one who builds the linkages with government officials, especially panchayat. Second is nurse, who is dealing with female patients specially. Medical consultant, who give the medical treatment and prescription of the medicines. Assistant, who do the registration and also mobilize the village before starting the camp.
Initially, the turnout at the van was very low, but soon when people came to know about our facilities and effectiveness of the medicine, and the number of the villagers started increasing, and people started having the faith on Arodhya Express, where they came to know how the effectiveness of medicine helped them in their sickness.
During awareness of the Arodhya Express, people initially felt that it will be the chargeable services and they have to pay for the medicines. But the team have told them like this services is totally free for the needy people in the villages, and it's under the CSR activity of Colorcon Asia Private Limited.
The introduction of the Mobile Dental Health Unit was a revolution in providing dental care facilities to the needy villages. Initially, when the team went on field, they noticed many oral hygiene issues which needed referral because the dental facilities were far away. But on follow-up, it was noticed that there was a nil response. This was because of the cost of treatments, cost of medicines, and also the need to travel to cities to get their treatments done. On analyzing the issues and citing the real need of a mobile dental health unit, Colorcon Asia Private Limited started the mobile dental health unit called as Arodhya Express Mobile Dental Van. On this van, we provide procedures such as cleaning, extractions, that is removal of the tooth, as well as filling, that includes the temporary as well as permanent fillings. Besides this, we give awareness sessions on oral hygiene measures. Also, we give tobacco cessation counseling to avid pan and tobacco chewers. In school programs, we give awareness sessions so that the oral hygiene measures are reinforced so that students can take good care of their milk teeth as well as permanent teeth.
Largely, we have diagnosed that there is a lot of hypertension, diabetes and anemia patients seen in last 5 years. So we check them every month and gives them primary medication so that their BP and sugar level to be in control. If any complication occurs, we refer them to the nearby PHC or gives them a referral letter and tell them to show any specialist.
We go daily to villages and examine the patient, and we got various diseases like hypertension, diabetes. Most of the people have generalized weakness, body ache because they are hard worker. They go on working. They never check their health. So we are going at the grassroots level, at the home, to give facility for them and to keep them healthy. And we treat the patients. The patients are very happy and they wait for us every month that we will come.
सांगपाचें पयलें म्हणत जाल्यार हांगा आरोग्याची हांगा कांयच सेवा नासली. आरोग्य एक्सप्रेस बस म्हणजे कलरकॉन हे कंपनीन तांकां दिल्ली आसा. ती बस हांगा ह्या गांवां येवन लोकांचे खातीर म्हळ्यार आमच्या प्रेशर जावं डायबिटीस जावं ह्या लोकांचे खातीर ती बरी सेवा करता.
आरोग्य एक्सप्रेस फॅसिलिटी सगळी बरी आहा. पयलीं आमकां मेळनासले पूण आतां खूब वर्सां जालीं आमकां दिता ते फॅसिलिटी.
Our health workers educate the people. People are free to talk with health workers and us. We are like friends to them. They can tell any element or anything without shy. to us. So we are always ready to help them. I have worked in also health services first, and the health workers from there are different from here, because here the health workers are like true friends. They know the patient, each and every patient, and their elements. So all the patients are very happy with us. So thanks to Colorcon company for coming out with this wonderful project under Voluntary Health Association of Goa.
Arodhya Express mobile van supported by Colorcon Asia Limited हांच्या मार्फत जे आमचे जाणटे लोक आसा तांकां चड फायदो जाला आसा. आमच्या गांवचे लोक जे गरीब जावन आसा तांकां जितलो फायदो जाला त्या बद्दल हांव ह्या मोबायल वॅनाचे आभारी आसा. मोबायल वॅनाचेर जे डॉक्टर काम करता, नर्सीस काम करता, तांणी बऱ्यापैकी आमच्या लोकांक समजून सांगिल्लें आसा. लोकांच्या घरा कडेन वचून तांणी काम केल्लें आसा. घरा कडेन जे लोक रावता, ते जाणटे लोक आसा, त्यांची मदत केल्ली आसा. ह्यो आमचे डॉक्टर नर्सी त्यांचे अभिनंदन जितलें करप तितलें थोडें जावन आसा. तेंचें अभिनंदन करप म्हळ्यार एक देवाक पांय पडप अशें म्हाका जर दिसता. बाकी कडेन गेले नंतर कितें करता की आमी प्रायवेट हॉस्पिटलांत वयता तेन्ना पयशे खातीर काम करपाचे लोक आसता, पूण ह्या लोकांनी जें काम केलां तें खरेंच अभिनंदनाक पात्र जावन आसा. ते ह्यो आमचे डॉक्टर नर्सी त्यांचे अभिनंदन जितलें करप तितलें थोडें जावन आसा.
आरोग्य एक्सप्रेस मोबायल मेडिकल युनिट कॉलरकॉन इतले फाटी तुमी सुद्दां खूब कडेन हांगा आयले आसा, लोकांनी बरो फायदो घेतलो आसा आनी हो असोच तुमी चालू दवरतले हे म्हाजी एक तुमच्या सरपंच वतीन तुमकां एक विनंती करता. असो तुमी चालू दवरतले, बेनिफीट हो सगळ्यांक जातलो.
आमच्या 2016चे पयलीं गांवांनी म्हाका दिसता खुबसो प्रॉब्लम आसलो, आनी जेन्ना आरोग्य एक्सप्रेस आनी कलरकॉन हेंची टीम हांगा पावली आनी तेंच्यांनी तेंचो आमकां हेल्प करपाक स्टार्ट केलो, ते पर्यंत म्हाका दिसता खुबशी आमच्यो पोखरमां जाल्यो, कार्यामां जाल्यो आनी परत प्रत्येक ज्या विलेज व्हडल्या ह्या गांवाच्यो समस्या खुबश्यो सुटलेल्यो आसा.
थँक्यू कलरकॉन. थँक्यू कलरकॉन.
थँक्यू कलरकॉन. थँक्यू कलरकॉन.
Special thanks to Colorcon Asia Private Limited for their services in the villages.
Will there be any remedy to such situations that are faced by the villagers quite often? The question had got a solution.